There are some elderly patients, as you can imagine, that just are not very into technology. They find it a little bit difficult to use or confusing. So from a purely medical assessment standpoint, no. I mean, age really doesn't matter from that perspective. In terms of being able to use the technology, yes, sometimes that can be a barrier. Another common barrier we see is that elderly people tend to have more sensory problems. So for example, they can't hear as well. And depending on the device you have, right, it may not be able to get loud enough, for example, for someone to be able to hear you clearly. And so you may need another person to provide essentially translation of what you said and kind of yell it loud enough for them to be able to hear it if they don't have hearing aids or something like that. Other than that, there's really not a lot of barriers. The way we have gotten around those historically is one of two. One is many elderly people are being served in a more institutional setting, meaning in a hospital or an emergency room or a nursing home or something along those lines. And so there is someone else around, right, that can help with the technology and help make sure they can hear and understand everything that's going on. And the same thing, if it's happening at home, it may be a family member that comes along to facilitate. And then, of course, having said that, there are still plenty of elderly people that are perfectly fine using technology and have no problem, with any of this stuff and use it very easily. So it really runs the gamut.